Hi guys, three things I want to talk about in this video about my GP trainee rotation in general practice. And obviously when you do GP training, you do lots of different rotations, but in ST1 or ST2, you're going to be doing a GP rotation in most situations. And I remember I did my GP trainee rotation in general practice in my ST2 year. And I'm going to talk about three things that I really took away from that rotation. Number one, how much I felt feared and daunted by it before I started. Number two, just how much I learned in that ST2 rotation in general practice. And then number three, how much I loved it when I look back and think about my time there right now. Now, I had done general practice before. When I was a foundation year 2 doctor, I did 4 months in general practice. But let's be honest, when I was an F2 doctor, I didn't really, what's the word here? I was quite naive. So I went into it and I did my 4 months, but I had a lot of supervision. I was in a bubble. I didn't really feel like, looking back now, that I was pushed to the extent that I was pushed when I was in ST2. But when I did general practice in ST2, it was a different ball game, because obviously you're seen as a GP trainee, you're a little bit higher in your career ladder, and the things that were expected of me were a lot different. So yes, I'd done general practice, but this was my first real job in general practice. And obviously I was trained to be a GP. So this 4 months was crucial, because if I didn't find this useful or I didn't like it, maybe I'd start to think about, did I make the right decision going forward? Now, I'm Dr. Amadora, I'm a GP, I've been educating GP trainees for many years, and I see some of the queries that people come to me when they're about to start their first ever rotation in general practice. Right, so number one, I felt daunted by it. I remember probably from a couple of weeks before I started my first GP training rotation, I started getting those kind of nervous feels that, okay, now I'm going into general practice. What if I don't actually like it? What if I find it too difficult? What if I miss the hospital environment? What if I feel isolated in my room? What if how am I going to deal with things without the ability of getting blood test results within an hour? How am I going to deal with the uncertainty of not being able to do an x-ray when I have those little doubts? These kind of things, if you're getting those feelings, or if you had those kind of feelings before your GP rotation, I completely resonated with it, because I really feared it. And I remember those 2 weeks leading up to it, I asked a lot of questions of a lot of people, and I tried to prepare myself as best as I could, and I read so many chapters in different books about general practice, thinking, okay, I've got to know general practice before I start. I remember when I first started it, that fear went away within a couple of weeks. Why? Because my practice was brilliant, my clinical supervisor at the time was brilliant, and I realized that actually, you know what, I'm coming in as a trainee. I don't need to know how to be a perfect GP at that point. I've got to just soak it all in. So yes, it was nerve-wracking. Yes, seeing patients on my own in that room, even though I knew I had somebody next door that I could go to, was very, very nerve-wracking. But I started to understand how the thinking around general practice is different to when you're in hospital turn. So yes, I feared it, and yes, I found it daunting, but that very quickly went away. And if you're feeling like that, then I totally get it, but it will go away. It is always going to be nerve-wracking when you're going into something that you haven't had experience of before. You don't know what it's going to be like. Your brain's going to start to give you all those kind of normal negative fears, as well as the excitement, of course. And I remember at some points I was very excited about it. I thought, well, this is my career, this is what I wanted to do. Now I'm finally going to get to do it, but that nervousness was there as well. So that's number one. Number two, when I look back at it, I think just how much did I learn from those 4 months? Now, learn in terms of medical clinical stuff, yes, how to see patients in general practice and the kind of things that you think about in terms of primary care as opposed to secondary care, how you learn to deal with uncertainty, how you learn to deal with vague presentations, how you learn to deal with the whole spectrum of general practice in terms of age and pathology and everything else. So I learned a lot in that 4 months from a clinical and sort of being a GP mindset, but I also learned a lot about being confident in my own ability. Those 4 months really showed me that I do have the ability to assess patients fully on my own, thinking about them from all directions. I do have the confidence and the ability to be able to make decisions. I have the ability and the confidence to start to deal with a little bit of uncertainty. And I also started to develop the confidence to know when I've hit my threshold, when I need to go and ask for help. And that was something that I learned in those 4 months that I kept with me for the rest of my training. And certainly when I went into my ST3 rotation in general practice, those things really stuck with me. And I hadn't learned those things to that extent in any previous rotation that I did. So the second thing is, when you do your rotation in general practice, whether it's 4 months or 6 months as an ST1 or ST2, Yes, it will be daunting, but you will learn so much, and it will set you up for your third year or your final year in GP training, whatever that happens to be. So that's the second thing. The third thing was how much I loved it. Now, I had those doubts, like I mentioned. Am I really going to enjoy general practice? Is it for me? I'd thought about general practice and other specialties for many years, but I finally decided on general practice. But you always have that doubt. Is it the right decision? Is it the thing that I can do for many years to come afterwards? And I remember finishing my 4-month rotation thinking I've got to go back now into hospital rotations, thinking, wow, I absolutely loved my 4 months. I loved that feeling of uncertainty. I loved dealing with that vague presentation. I loved the connections that I built up with the patients that I saw. I loved the teamwork that I got used to in that practice that I was working in. I loved the fact that I could jump next door and I could speak to one of the nursing staff, or I could speak to a healthcare assistant, or I could speak to one of the receptionists, I could speak to one of the secretaries. It was such a nice feeling to work do medicine within that type of environment. And I remember thinking, okay, now I've made the right decision. And yes, I had my doubts before, and those 4 months allowed me to realize, okay, now I can see myself doing not just my ST3 year, but then working as a GP in the future. And that was really powerful for me, because that doubt always lingered until I did my proper 4-month rotation as an ST2. Like I said, I had done general practice in F2, but my mind wasn't really there at that point, and I was very mollycoddled in that role, and I didn't really have that chance to have to learn and think about it for myself, whereas that ST2 rotation general practice really gave me that confidence. There's 3 things, if you're going into a GP rotation right now, and you're about to do your first ever general practice rotation, maybe you haven't done it in F2, maybe you haven't even done foundation year training, then those 3 things hopefully will be there for you as well. Number 1, the nervousness and the excitement. That is going to be there, and I'm sure that's a part of what you're thinking. If it is, it's very normal, you're not alone. Number 2, you're going to learn a huge amount, not just about medicine, but about how you consult in primary care, and a lot about your own confidence levels and where your limits are, and how you can deal with things like uncertainty and vague presentations. And number 3, hopefully, you're going to feel like, okay, I love that so much, and I can't wait to come back into general practice in my final year, given that I've probably got to do another couple of rotations in the middle. So those 3 things hopefully will work for you. They may not all work in the same way for you, but certainly for myself personally, those 3 things really struck home. And when I look back at my ST2 rotation in general practice, I think that although in ST3, my final year in general practice, I learned obviously a huge amount, and I became the GP that I was training to be, that 4 months in general practice put so many foundations, set so many things on the right path, that I was able to take the full advantage of my ST3 year and then going into a newly qualified GP a couple of years later. Now, hopefully there's been some value to you if you're about to do general practice yourself. If you have any questions about doing your general practice rotations or anything to do with GP training at all, please do let me know. Follow us on social media, subscribe on YouTube, Dr. Amin Arora, Facebook, Dr. Amin Arora. We have a national GP training support group that you can join on Facebook, Instagram, Dr._Amin_Arora, and Twitter as well. We have a couple of courses that might be really useful for you if you're about to do your first GP rotation, and you can get 10% off those courses with the code AuroraVideo10. AuroraVideo10. We have 2 things that might be of interest. Number 1, our GPST1, GPST2 50 key presentations audiobook, where I break down 50 of the commonest things that you're going to see on a day-to-day basis in general practice, and how to think about them in that general practice framework. So there's that audiobook that you might want to look at. And also, if you're a GPST1, then we've got our GPST1 Trainee Max online course that tells you everything that you need to know as a GP1 trainee if you're about to start GP training in general. Again, any of those 2 courses, Aurora Video 10, will get you that 10% code off. Really, guys, I really hope this has been some value. Like to ask me any questions you have about GP training. Whenever they come to you, please contact me at any point that you need. You know the hashtag Campus Will Pass. You know the second hashtag, I went with Aurora. Those 3 things were super, super important for me. Number 1, I felt feared and I felt daunted, and you will as well. Number 2, I learned a huge amount in my GPST2 GP rotation. And number 3, I realized how much I love general practice. Take care.